This is a tiredness hypothyroidism station. Usually it comes later on in two forms or with a twist at least. Here there is one scenario which says that you are referred to work in GP and the patient's presented with tiredness. In the other scenario, it is also the patient's presented with tiredness, or she's presented for some test results, and the test results show that she's having hypothyroidism. The T3 and T4 are low, and the TSH is high. So simply, this station is very easy. You'll enter, you'll find the patient is feeling tired. Doctor, I'm feeling tired. Elaborate the tiredness. It is tiredness since 6 months at least, or a few months. Okay. And it's getting worse in physical activity, and it's not relieved by rest at all, and it's continuous all the time. So you will ask her what else. She will tell you weight gain. So now you know that this patient is having tiredness with weight gain. The only tiredness which happens with weight gain is either obesity or hypothyroidism. Obesity or hypothyroidism. Why? The patient of hypothyroidism, the patient of obesity is worried, is tired because of the weight gain. But the patient of hypothyroidism is tired and having weight gain at the same time. So the main presenting complaint here in hypothyroidism is the tiredness and not the weight gain. Okay, so the patient is having tiredness and weight gain. What else? Here comes the importance of this question, because the patient will tell you, yes, doctor, I am also feeling cold. So cold intolerance here. You will tell her since when it started, how did it start, has it changed? For any complaint, ask all these three questions. Okay, so now what are the associating symptoms that I should not miss here? You can also ask about the period. Very important actually to ask about the period in the hypothyroidism case. Okay, what else you can ask? You can ask about the rest of symptoms of hypothyroidism. Like what? You can ask her about constipation. Elaborate the constipation. She's usually having constipation since the past few weeks as well. What else? She's feeling low, which means that she's having depression. Score the mood and elaborate the mood very well. And also at the same time ask about associating symptoms of the depression. Like what? Do you feel guilty? What about your sleeping habit? Okay. Do you enjoy your daily activities? For example, do you have any loss of appetite, or do you enjoy your appetite like before? Have you ever thought of harming yourself? Because remember, this is history of depression. Okay. You can also ask about any dry hair or any muscle cramps, because those are the other associating symptoms of the hypothyroidism. Past medical history, you can ask about what you wish. It's not conclusive, but the thing is that she is having only family history. Sometimes her daughter is having anemia, so this is irrelevant. Okay, in that lifestyle as well, it is not that conclusive, nothing new. Do not forget here to ask about the low mood questions, which are the social history or the famish. When any patient gives you low mood, always ask these questions. How is your family, or whom do you live with? How is your relationship with them? Do you have friends, and how is your relationship with them? Do you have any problem with the are you financially stable, and may I know what do you do for a living? And also one more important thing, do not forget to ask about any problem like any alcohol or any recreational drugs. Okay. In the end, we agreed that this is long-standing complaint. So ask the patient, may I know how has this affected your life? She will tell you that it has affected her life in terms of, like for example, she cannot cope, she cannot meet her relatives, she's always tired. Let her speak. You are taking marks for your interpersonals. What are the differentials that you could rule here? The differentials could be inflammatory bowel disease, and they could be also malignancy. Okay. Okay, but usually you will not have to ask about them. You can simply ask, for example, about the hypothyroidism and the depression, very enough. Okay, which examinations to do? Examine the gland in your neck. Examinations are not conclusive. Which investigations you need to do here? Usually like the task. The task tells you. But even if the task is not mentioning, here you can say it's hypothyroidism because of the symptoms: tiredness and weight gain and cold intolerance and constipation and depression. What is hypothyroidism? It is a condition in which the thyroid gland, which is the gland in the neck, is underactive. This gland is responsible for hormonal production, which breaks down the food into fuel or energy. Okay, why does it happen? Usually there are too many reasons, but one of the important reasons actually is the autoimmune problem. Autoimmune problem, which means that our immunity, instead of fighting against the bugs, it fights against our own tissue. Okay, okay. What are you going to do? The normal, the routine bloods and ECG. For thyroid, anything in thyroid, you need to do routine bloods and ECG. Routine bloods including the thyroid function test and ECG to confirm the heart condition because thyroid problems affect the heart. How are you going to treat the patient? Hormonal replacement therapy. What is this? There are a hormonal replacement therapy called levothyroxine. She will ask you, how long will I take? You will say lifelong. However, the good thing is that thanks to this treatment, you'll be able to resume your life activities or your daily activities. Very nice. Okay, so we will start here. In this case, actually, we will start here on low dose of thyroxine, and we will taper or we will gradually increase the dose, okay, till it reaches the desired effect. Okay, remember that in GP you can treat hypothyroidism completely. So you are going to increase the dose to reach the desired effect, and for that you are going to monitor her or do blood tests at least once per year to monitor her thyroid function test. What else can be done? You can also address her depression. Always remember that this station is not only about hypothyroidism, it is combined hypothyroidism and depression. For the depression, you will simply advise her about lifestyle, to be active, to involve herself in social activities, to try swimming classes or yoga classes as well. And you can refer her to a counseling or talking therapy, which is cognitive behavior therapy, and ultimately the psychiatrist may prescribe for her some medications, but usually do not mention the medications. Okay, why? Because the depression here is secondary to hypothyroidism. So once the hypothyroidism is treated, the depression is gone. Please do not mention the medications. Just suffice with the lifestyle, like for example socialize and maybe CBT. Okay? Okay. This is the first station, the hypothyroidism. Second station is quite similar to it, which is in scenario, the hypothyroidism as well, but the difference only is that in the task it says that thyroid function tests have been done, which means that you already know the diagnosis before entering. It's hypothyroidism. But in the previous script or the previous scenario, you only know that the patient is coming complaining of tiredness. Okay, and when you enter, you'll find tiredness with weight gain. So it could be two possibilities, either obesity or hypothyroidism. But the patient will give you as well cold endurance, which matches the hypothyroidism. By the way, the weight gain have been only recently, which means that it cannot be obesity, because the obesity actually is very long-standing, like maybe since childhood, but hypothyroidism started occurring recently. And the tiredness started occurring recently as well, which points toward something related to the thyroid and never related to the obesity, which is usually since very long. Okay, so third thing is that let's go with the thyroid problems. Next station is hyperthyroidism. In the hyperthyroidism station, you're FY2 working in GP. The patient is 40 years old, female patient. She's coming for her test results, for which she has been complaining of tremors and sweating. The test results show that the TSH is low and the T3 and T4 are high. Talk to the patient and discuss her test result. You'll enter the cubicle, you'll find an anxious girl, in the middle-aged girl. She is sitting restless, and she will tell you, doctor, my parents think that I'm losing weight. Sometimes the task says that the patient is presented with weight loss. So the task can be either tremors and sweating or can be weight loss as well. In both cases, you already know that it's hyperthyroidism from the test results. So she will tell you, I think my parents think that I'm losing weight. The first question to ask is always, what do you think? May I know why? Because this question is very important. This assesses her insight. If she's having insight and if she's aware that she's losing weight, this means that it is hyperthyroidism most probably. And if she does not believe this, This means that she is having anorexia nervosa because the anorexia never accepts the fact that she is losing weight. So she will tell you, yes, doctor. So elaborate the weight loss, like since when? Has it changed? Has it been intentional, or have you planned to lose weight? So when someone is losing weight, we need to ask some questions which can be related to it. So ask directly about the diet, like number of meals and the content of each meal, and yes, the content of each meal. Very important to ask this to assess the reason for the weight loss. Maybe it's related to the diet. You can also postpone or delay the diet question till the end, but I mean it's better to bring it just after the weight loss. What are the associated, now you know that it's hyperthyroidism. What are the associating symptoms? Number 1, sweating. Ask about it. Number 2, do you feel hot when other people feel okay with the weather? Which is heat intolerance. Ask also about one important thing, which is the heart racing. Heart racing is characteristic, remember the AF is a strong association with the hyperthyroidism. So ask about heart racing and she will give you episodic heart racing, very similar to the AF. Episodes which come on physical activity and relieved by rest. Okay? Okay. What else? Ask about the diarrhea. She can be having bouts of diarrhea as well. No constipation in between. And ask about the period. Remember, in the previous station we asked about constipation. In this station we ask about diarrhea. In the previous station cold intolerance, here it's heat intolerance. Okay? In the previous station we said dry hair and skin and coarse hair. Here we are saying about sweating, which is the opposite. So this patient is having diarrhea, so we need to ask about dehydration, because one of the important complications of diarrhea is the dehydration. Simply we ask about dehydration. Do you feel that your mouth is dry? Okay, do you notice any reduced or decrease in your urine output? Elaborate the period as well. She will tell you that the period has been irregular in the past few weeks. You will say that she is restless or she is having tremors. Always ask her, may I know what's bothering you? She will say nothing, doctor. So she is just anxious because it's manifestation of hyperthyroidism. If you have time, you can ask her about any visual problem or problem with the sleeping due to the stress. Past medical history is not conclusive at all, but you can ask like any fever or flu-like illness, any medical problem, especially autoimmune problem. 4Ps must be asked here because she's female patient and we already asked about the period. It's better to put it with the 4Ps, but if you asked about it before and associating symptoms, it's fine. Lifestyle also is not that important. Smoking to ask. What are differentials? We see the differentials are hyperthyroidism, could be IBD as well, red inflammatory bowel disease, could be as well HIV, and could be cancer. But you do not need to rule out many things because you already know from the test results. Okay, so here the examination, nothing. The investigations again, thyroid and routine bloods and ECG. Disclose to the patient you're having condition we call hyperthyroidism, overactive thyroid gland, which is a gland in your neck. Explain the thyroid as previous station as well. What are you going to do for me? You will tell her that we have done some tests. Let me show you the result, and then explain the result of TSH and T3 and T4. T3 and T4 are the hormones which are produced by the gland which mainly responsible for the food breakdown. Their secretion is regulated by a hormone we call TSH, which is produced by the gland in the base of your brain, the pituitary gland. That's why this hormone is reduced when the other hormones, the T3 and T4, are high in the blood, which happened in your case. What are you going to do for me? Or why do I have this problem? Usually this patient is having family history. She will give you family history of her mother or sister having hyperthyroidism. So say that it runs in family. Very important to say that in your case usually it runs in family, so in your case it's most probably the possible cause. Okay? Okay. However, we need to run further investigations. Which investigations? You will usually run antibody test. to confirm the reason for her diagnosis. Okay, for the antibody test actually, after the antibody test you will confirm the reason of her thyroid problem. What will happen? Usually she will be referred to specialist. So after the antibody test she will be referred to specialist because the specialist will start her on the treatment. Which treatment? 3 therapy, 3 drugs. Number one is carbimazole. Number 2 beta blocker, and number 3 radioactive iodine. Carbimazole will be taken for a few months. And it will be monitored regularly, the level of the drug and the blood test and the thyroid hormone level or function. Carbimazole side effect is usually, which is very important, liver affection, the most important side effect. And you can open the BNF here. One important thing as well is that it's affecting pregnancy, so it's important to always plan your pregnancy and inform us before deciding to be pregnant. Other side effect which is very common is the agranulocytosis, which is a reduction in the white blood cells. So tell the patient that if you have any infection or fever or flu-like illness, we're more likely to follow up you or check on you. What is the other medication? The other medication is the beta blocker, the propranolol, to reduce her heart racing, which she already had. The third medication is radioactive iodine, okay, and it can be given in the cases in the other medications did not manage completely. It needs to be monitored regularly under the effect or under supervision of specialists, and one of the side effects is shrinkage of the gland. What are the warning signs here or the follow-up? Here you must warn the patient that if you have any heart racing which is not relieved, and if you have any extensive sweating, come back to us, because this means thyroid crisis or thyrotoxicosis. This is one thyroid station which is quite easy and lovely station, but it's a little bit lengthy. Next station is chronic fatigue syndrome. In this station, simply your FY2 working in GP. The patient is middle-aged male patient presented with tiredness. Other information: the patient has come to the GP clinic 6 months ago after an episode of flu, and he was having the same complaint. He has been given medications, but he did not improve. The IT system has crashed here, and you have to take full history from the patient and assess the patient and address his concern. So the IT system is crashed, which means that you should take history from the scratch, because you do not have any medical record about the patient at the moment. Okay, so what you will do, by the way, I had this station in my exam, and the guy was really tired. He was having even red eye. I don't know how he could do it. He was really tired. He was not that cooperative, but he was a nice guy. For example, he's open up to any talk from you. So you have to reassure him and be slow a little bit here, because this guy's already tired. So what is your presenting complaint? His presenting complaint is that he came back again and he's still tired. Are you comfortable to talk? Yes, doctor. Tell me more about your tiredness. Doctor, tiredness started, he will tell you 6 months ago after a normal flu. And this tiredness is getting worse, especially when he is doing any physical activity, and nothing makes it better. What about the flu? He has taken some medications for the flu 6 months ago and it has gone. Okay, do you have any other symptoms? He will tell you that he's having aches all over his body, pain all over his body since his last flu. Okay, ask him where is the pain. He will tell you all over my muscles, and it's getting worse. And he tried some painkillers and they did not help him at all. Okay, now you have the patient who's having tiredness and generalized body aches after flu. So this is tiredness after minor illness, which could be chronic fatigue syndrome, most probably. Why chronic fatigue syndrome? Chronic fatigue syndrome is a like tiredness for no medical reason, only after minor infection, which is not a medical reason for his tiredness. Okay, we need to ask now about other symptoms of the chronic fatigue syndrome. Like what? You can ask the patient about Maybe if he's having problem with the sleep. If the one is tired for long, they will not be able to sleep properly. You can also ask about lack of concentration due to lack of sleep as well, or due to tiredness. You can, when someone is not concentrating well, they will likely to forget. So ask about the memory if you have any memory problem or have been forgetful lately. You can also ask the patient all these questions definitely, like tiredness and lack of sleep and forgetfulness may lead to mood changes, like maybe depression. So ask about the mood. And remember, this is long-standing problem. Long-standing problem, always ask about how has this affected your life. He will tell you it has affected my life. I cannot go out with my family. I cannot walk my dog. I cannot do anything, doctor. This is really tiring to me. Please help me. Okay. Okay. This guy is having low mood and is having medical problem. So ask some medical history. Okay, what are your differentials here? Someone who's having long-standing tiredness for no reason, at least rule out cancer and diabetes and anemia. Cancer and diabetes and anemia. Other portions of the history are not conclusive here or are not that important here. Okay, if you want to ask about more symptoms as well, you can ask about maybe kidney disease. The kidney disease, chronic kidney disease, like any swelling in any part of your body. Okay. Family history is not conclusive and nothing is conclusive here. Now move to the lifestyle. He smokes, he drinks alcohol, and he's not maintaining a healthy balanced diet and he is not that physically active. Or he used to be. Then take some social history because the guy has told you that he's feeling low, and definitely from his look he is feeling low. Social history here will include how is your mood recently? Very important. He will tell you that I'm feeling a little bit low. I'm so sorry for that. We're definitely going to help you. Then ask about the family and the friends. It's very important to ask about them. Okay? Okay. So, in the examination part, you will do generalized body examination. Okay? And all the examinations are normal. And the investigations, the examiner will not ask you because he needs you to say to the patient, what's wrong with me? You will tell the patient that your tiredness doesn't have any medical reason. However, we need to run further investigations to find the reason. And if the investigations come back normal, this means that you're having chronic fatigue syndrome. What is this? It is a tiredness for no medical reason. And sometimes it can happen after minor illnesses like the flu that you had. What are you going to do for me? You will tell him that we're going to do full investigations, all the bloods, okay, and urine test as well. You will also do ECG scan. Okay, doctor, is it serious? You will tell him that it's not serious from the symptoms you told me. You don't have anything serious. However, we need to do further investigations to find out the cause. Doctor, can you give me some tonics? Basically, he means vitamins. So you will tell him that we cannot give, definitely we will prescribe for you vitamins, but you need to maintain healthy balanced diet as well to get the best benefit and the best outcome from the vitamin course. And then what you can recommend to me, doctor? You'll give him some lifestyle advice. Like what? Regarding, you'll advise him about to have enough rest. Try to be a little bit physically active. It can be gradual exercise, for which we are going to refer him to gym instructor to start him on graded exercise program. You can also try avoiding stress by having yoga or meditation. Try to have enough sleep. You told me that you're not sleeping well. It's very important to maintain proper sleep to manage your tiredness. Also advise him about the smoking. And you advised him about the vitamins before, so you will advise him right now about the balanced diet to get the best benefit from the vitamins. What else? If these measures did not help him and he is having mood problem, we can refer him to one of our colleagues, psychiatrists, to arrange talking therapy to him or talking sessions to him. So definitely this station is diagnosis of exclusion. No reason at all for the tiredness, and the findings are all matching the chronic fatigue syndrome. I hope this was clear. Okay, next station. Next station simply is one of the most, many people consider it as a ghost, but I like it. I had it twice. I had it in my first attempt and in second attempt. And I scored 9 in second attempt. Then I scored 6 in first attempt. And I passed it in both attempts, but still it's challenging because the simulator is not good at all. He's very bad really. He's a very bad guy. Anyway, so let's start. Your FY2 working in GP. The patient is, he was middle-aged male, like 30 something years old, and he was presented with sleep problem. This is his concern, and he's having tiredness as well. So the patient presented with sleep problem and tiredness. So talk to the patient and address his concern. Into the cubicle, you'll find an overweight guy sitting on a chair, and you will tell him, how can I help you? He will tell you, doctor, I'm feeling tired these days. So this is one station of tiredness as well. So elaborate the tiredness. You will find that the tiredness started maybe a few weeks ago. It's not changed at all. It's continuous all over the day, especially throughout the day. I mean, as the day goes on. And it's not relieved by sleep. Actually, I'm having trouble sleeping as well. When someone is telling you about trouble sleeping, you will ask him, which trouble sleeping? Like, for example, do you fall asleep later? Or do you wake up in the middle of the night? Or do you wake up early in the morning? He will tell you, doctor, I have difficulty. For example, I wake up in the middle of the night sometimes. Okay, so any particular reason for that? He will tell you no, but my wife noticed that I have been snoring. Do you cease breathing or do you stop breathing while snoring? She says yes as well. May I know for how long? She says for 10 or 15 seconds, doctor. So basically this patient is tired because he does not sleep properly, because he wakes up frequently in the middle of the night, because he snores in the middle of the night, and his snoring is due to obstruction in the airway, which is obstructive sleep apnea. Okay, do you have anything else? Like what, doctor? You know, when someone is not sleeping properly, they tend to be having a problem with the concentration. So do you have this? No. Or yes, he will tell you yes. Do you have any problem, like do you feel like the previous station exactly? Problem with the memory, problem with the concentration. You can also ask him, do you feel refreshed when you wake up early in the morning, because you told me that you do not sleep well? You can also ask him about maybe any anxiety or stress. You know, when someone is not sleeping properly for a long time, they're having problem with the mood as well. So you can ask him about the mood and the depression. Sorry, the stress and the depression. Now move to the past medical history. It's very important actually here. Why? Because you will ask him about the recent health. Always ask about any recent infection, especially the upper respiratory tract infection. Ask about any other medical condition, especially the diabetes mellitus. Do not miss the diabetes, please. And do not miss the hypothyroidism. Do not miss the diabetes and the hypothyroidism, because this patient is really overweight. Do you take any medications, any sleeping pills? Because the sleeping pills are usually associated with insomnia due to the withdrawal. Family history as well, good to ask. Move to the lifestyle. It's important because the patient is smoking and he is an alcohol drinker and he is overweight, so he's not maintaining healthy balanced diet, and the patient is not physically active. Very important. The core of this station, which if you miss, you will fail this station. You must ask about the profession of the patient, because he's a lorry driver, and this is the risk, this which puts him under risk here. Okay, and how are you coping with this? How has this affected your job? Remember, this is long-standing complaint, so always ask in the end of the history, how has this affected your life and job? He will tell you, doctor, I cannot focus that much. Okay, ask him, have you felt or have you experienced sleeplessness during, or have you experienced any sleepy episode during driving? He will tell you thankfully no. Literally, he will tell you thankfully no. Okay, so now move to the examination. You will perform all the examination, including chest examination and ENT, ear, nose, and throat examination as well. And you can examine the heart and the tummy as well. And do not forget to examine the airway. All the examinations are normal, but in the general physical examination, you have to verbalize that I need to check your weight in relationship to your height. BMI is the other core of the station. If you miss one of two things, you will fail the station. So always mention the BMI. I need to do some investigations, at least routine blood and ECG and urine. Again, like any tiredness. What is the diagnosis, doctor? Obstructive sleep apnea. What is this? Cessation of breathing during sleeping due to a problem in the airway or obstruction in the airway. Why did I have it? Okay, it's more likely to occur in the short people, or the people whose weight are over a little bit, because usually their neck are more lumpy or are more fat, which presses on the airway and causes airway obstruction. Also, it's more likely to occur with smoking, and it happens when someone, for example, is taking recreational drugs, or if someone maybe was having like adenoid, which is a large tonsil as well, which is not the case in you. So his only finding is a high BMI and sometimes smoking as well. What are you going to do for me? We are going, number one, to perform some tests for him. Which test? We are going to perform a routine blood test, and then we'll refer him to specialists to discuss the management plan and do some investigations as well. Usually the specialist will do like video monitoring of the guy while sleeping, and he can also put pulse oximeter under his nose or in his finger during sleeping to monitor his oxygen saturation during sleeping. But the treatment here will be continuous positive airway pressure, the CPAP. Why? To push oxygen under high pressure into the airway to relieve the obstruction, especially while sleeping. And the other options are something which called shield. You know the shield, like the American football players? They put it to prevent the mandible or to prevent any trauma to the mouth. He can also put it to prevent any receding in the mandible. It's not important here anyway. Okay, his main concern in this station is how you treat me, which you already mentioned. And number two, how about my driving? You will encourage him to inform the DVLA. What will the DVLA do? They will assess him again, assess his symptoms. If he is compliant with the CPAP and his symptoms are getting better with the CPAP, this means that he is more likely to resume driving. But if he feels sleepy even during the CPAP while driving, this puts him at risk of accident. So the DVLA may reconsider his license. Are they going to take the license from me, doctor? Well, they are just going to check you again. But doctor, they may take the license from me. I will not tell them. I can see it can be frustrating, really. But you know, the thing is that we are doing this for your sake and for the public as well. This way you will put yourself and the other people as well under the risk of too much accidents. And I'm sure you do not want this to happen to you, neither to your family. Okay, thank you, doctor. Thank you. So this is a station of the obstructive sleep apnea. I consider it very easy because it is one of its type.